Welcome back, everybody. Usually it's your pediatrician who is checking your child's vision as they head into pre-K and kindergarten. But as your child gets older, you of course need to go see an optometrist. But everybody, if your child is starting to see some signs of vision problems at an early age, you need to talk to that pediatrician. And guess what? We still have a pediatrician with us, everybody. Dr. Anthony Hudson is the pediatrician at Children's Hospital, New Orleans. And I'm so excited to be having this conversation now about vision, because obviously I've had glasses my whole life, right? I got glasses in the first grade, Dr. Hudson. And I want to ask you this, like, what age do children usually start to see vision problems?
So your pediatrician is screening for vision problems from birth. We're doing certain exam maneuvers even in the hospital or the newborn nursery, if you will, to screen for problems with your infant's vision. But as we move forward, those exam techniques change, and we also start to begin to use instrumentation to screen your child's vision as they're going into school.
So when parents out there who are watching this right now, who have children who are not going into pre-K and kindergarten yet, they want to check their child's vision, when they go to the pediatrician, what does a vision test look like at that age?
So it can be very age dependent. I would say as you're going into the pre-K, if we could say, for example, 3 to 4 years of age, most offices are using photo screening to determine if there is potentially a problem with perhaps the alignment of the eyes, or even the ability to focus the image on the retina, which then allows us to have a more formal screen with an ophthalmologist.
Wow, so other professionals will have to get involved. I'm curious, like, when you all are looking, what are some of the signs that you all see from the doctor's perspective and then from the parent's perspective as well, to see if their child has a vision problem?
So some things I'm looking for in clinic is something we call the red reflex, where we're just looking to see the fundus or the back of the eye. And there can be certain conditions such as retinoblastoma or perhaps a cataract that can obscure the eye and give this white appearance. Certainly, we're looking for that even at a very young age.
Wow.
There are genetic conditions that can predispose you to that. From a parent perspective, or things to look out for at home, just a few things would perhaps be maybe tilting of the child's head. I think frequent blinking can be concerning at times, or perhaps, again, just directly the parent noticing themselves that the alignment of the eyes may be off.
Of course, like squinting in the classroom, if the child is saying, I can't see mommy or daddy, you know. And of course, if the teacher is telling the parent as well, right, I think your child may need glasses. That's also a resource as well, correct?
Yeah, I would add to that, you know, those are all great points, but maybe even headaches. I find personally that is a heralding sign quite often with vision problems, is the child complains of a headache first, and then we discover that they need glasses.
Wow. And my whole family wears glasses. Shout out to the family. If I wear glasses as a parent, is my child more likely to also wear glasses? Is there a genetic component there?
I'm unaware of any specific genetic conditions or components to multiple family members having to require glasses, but we did allude to some other problems such as retinoblastoma that can run in families, but again, that's unrelated to wearing glasses.
Fascinating. Now, I gotta ask you this, doctor. When children wear glasses, right? And I'm curious, as we go throughout this, like, I'm sure there are different types of glasses that children need and stuff, but I was reading, preparing for this interview, that there's an uptick in nearsightedness. Shout out to all the people who are nearsighted, like myself, you know. Why is there an uptick, especially in children right now? Do we know why?
So nearsightedness or myopia, where the image is focused in front of the retina instead of on the retina, making vision at distance difficult, is becoming more prevalent as we screen or tabulate these statistics. Exactly why, I don't think we quite have an answer for that. Certainly we postulate perhaps upticks in screen time, or more broadly speaking, focusing your attention maybe a mere 2 to 3 feet from your face versus off into the distance.
Wow. Now I'm curious, you know, earlier we were talking about immunizations and now we're talking about vision tests. How early should a parent be going to get that vision test for their child, getting those immunizations for their child? 2 weeks before class starts, a month before class starts? How do they know when?
So I like to remind parents to come in at their child's birthday for their yearly visits. And as we've already mentioned, we're doing these screens at each well visit. But of course, we're doing more of those during the summertime. You know, we're not necessarily in the midst of a flu season where we're seeing lots of sick individuals. We are doing more well visits at our LCMC clinics right now. But I think that's more from a logistical perspective. It's just easier for parents to get in at this time of the year versus pulling their child out of school for these visits.
I love it. Well, Dr. Hudson, thank you so much for joining us today in our
you for having
LCMC
me.
Health Wellness Lounge. Get those immunizations, get your child's vision checked, everybody. And look, if you want more information about any of the topics we talked about here in our LCMC Health Wellness Lounge today, head over to the website on your screen. It is CHNOLA.org. You can also give them a call at 504-547-7712 for more information.